Good morning, everyone. Previous class we had been learned that socialization. The key points: socialization in the hospital and rehabilitation settings. Then interdependence of individual and society. Individual always depends on society to fulfill their needs.
Good morning, sir.
Good morning. Anusha Kuti. Anusha, question.
Good morning, sir.
Good morning, Aswini. Aswini, can you answer for the question? Question is that can you list what are the factors influencing the socialization process in hospital? Aswini. Socialization process, factors of socialization process in hospital. You can read out.
Imitation, succession, language.
Is identification and language. Can you explain about suggestion? Means provide guidance or directions to others. Every healthcare professionals in the hospital mutually given suggestion to improvise the healthcare delivery. Okay, thank you. Today we have to start with, look at this. Interaction of body, mind and society. Body and mind. When we behave in society, first affect brain and nervous system. Next, which is directly influence immune system and endocrine system. If we have positive behavior in the society, we can experience our chemistry of body will be functioning or secrete the healthy hormones. Level of hormone is healthy level. If we interact with society negatively or unable to solve problems in the society, the endocrine system may be abnormally secrete the endocrine hormones, for example, dopamine and other stress hormone may be secreted. the immune system gradually reducing. Functions of immunofunctions gradually reducing, which cause opportunistic infections. So, if reducing the immunity power, opportunistic infection cause communicable diseases. Then endocrine system abnormally secrete or imbalancedly maintain the hormone level, which cause non-communicable diseases. Okay, so the interaction body and mind, when we interact with society, which is directly influence the communicable as well as non-communicable diseases and affect health status of people. Stress. The term stress, it is currently used by Emile in 1936, who defined it as the non-specific response of the body to any demand for the change. So, who coined the term Emile? This question may be asked in competitive examination. 2 more questions. Keyword non-specific response. Demand for change. Stress and health. The real measure of health is not the absence of disease. Okay? Not absence of disease, but the ability of human organism to function effectively within a given environment. Physical changes depends upon individual perception according to individual differences. How to perceive the world. If we have perceived positively, we can experience good health. If negatively perceive, may affect health status due to stress and other issues. So, what is the real health? Not the absence of disease, okay? Ability, human, function effectively given environment. Whether positive environment or negative environment, we can change the environment, okay? We can solve the problem in this society and make our society become positive and promote health. Then physiological response to stress. It is a process. If a person interacts with society, first what will happen? Anxiety. In every interaction can some kind of fear or anxiety is there, whether mild or severe or moderate. Okay? The human body cope with that anxiety or fear. So that to cope, unable to that experiencing this stress, if cannot solve that environment, we may be experience severe stress. The reason is that the physiological process. Hypothalamus, where situated pituitary gland. The pituitary gland is a muscle gland, stimulate all other endocrine glands. Can you name few endocrine glands Jefflin Saija.
Yes, sir.
Yes. Can you name few endocrine glands?
Pancreas, parathyroid, hypothalamus, adrenal.
Excellent answer. Thank you, Jefflin. So, for example, adrenal gland, which is situated at top of the kidney, which may secrete have been secreting the adrenaline as well as noradrenaline, which is responsible for the blood pressure. The central ventral portion of brain have been affected. The nerve system, parasympathetic and sympathetic and autonomic system, have been affected by social situations, then which cause physiological changes. What are the changes? Change heart rate, breathing will be changed, blood pressure, then other changes. All parts of body, all system in the body have been affected by social situations. If we have good environment, the positive is very important. If we have to interact with positively and solve all the problems which make our chemistry of body become balanced and which cause to good health. If unable to solve the problem, experience the stress due to negativity and cause to all the endocrine glands secrete stress hormones and abnormal changes in the heart, in the kidney, in respiratory system as well as reproductive system, so which leads to cause the diseases. Okay? Non-communicable diseases is caused due to endocrinal imbalance. So the stress directly impact on this immune system, immune system. The immunity power gradually reducing, which cause to opportunistic infections and which leads communicable diseases. So clear about it, how a person experiencing the disease due to social situations. Okay? That's why we have been emphasized that every social components used as a medicine can cure the diseases and prevent the disease sustainably. And look at this, some more explanation regarding what are the physiological changes in the time of when we interact with society. Increased heart rate, rapid breathing, relaxing of stress, releasing of stress hormone, BP increased, muscle frightening, change blood flow, pulmonary as well as then heightened senses, perspiring or sweating, imbalance, normal hormone levels. For example, insulin may be increased, which causes to diabetes. In addition to changes or following changes, increase CNS activity in the brain and sympathetic and parasympathetic nerves. Increase circulation of fatty acids, which cause non-communicable diseases, increase output of blood cholesterol, so which cause cardiovascular diseases, the release of endorphins, which means stress hormone from the pituitary gland, dilated pupils of the eyes, hair stand in end, goose flexion, increase brain wave, saliva dries up, decrease perception, kidney disease, which means kidney decrease output, which means urinary system affect. Then bowel, bladder, sphincter close, which means the rust. Digestive system also affect. Then inhibit erection and vaginal lubrication, which means reproductive system also affect. So which fact is that every components of, which means every system or every component of human body have been affected by social situations. Look at this pictorial representation. Here pituitary gland situated, hypothalamus, amygdala. So when we interact with society, first affect the pituitary gland, through perception. 5 sensory organs perceive the social situations and in the environment. First, pituitary gland see that and try to stimulate all other endocrine glands. If unpredictable situation, kidney is there. Can you see our kidney? Can you see the kidneys? Top of the kidney there is situated adrenal gland, which has been secrete adrenaline. If abnormal secretion of adrenaline increase heart rate. Can you see the heart? Yes, when increase heart rate, what will happen? Automatically breathing will be changed due to lungs, pulmonary circulation, lungs automatically change the breathing. So not only that, if blood circulation increase, breathing will be changed, whole system will be affected by social situations. So normally everyday life we can experiencing all these stress, moderate as well as and little bit of stresses, but severe stress only ended with the diseases. Look at this. These are the CNS, central nervous system, brain, spinal cord, parasympathetic, sympathetic nerves, PNS, parasympathetic. Then system involved to stress. First system, enzymic system. Which system secrete enzyme? The digestive system have been secreting the enzymes, for digestive purpose. So abnormal secretion of the enzymes which may cause digestive problems. For example, as well as other digestive juice, mainly the digestive process using some acid, hydrochloric acid in stomach, which may cause peptic ulcer, abnormal secretion due to the social situations. Then endocrine already we had discussed. Second system, organic system. Organ means every system, organs of our body, kidney, heart, as well as hepatic system, neuroendocrinal systems. Third one, nervous system. Fourth one, psychological system. So psychology means already we had been learned last year: perception, learning, memory, motivation, intelligence, personality. So every components of mind will be affected by the stress. Fifth one, socio-cultural system. So these students, social cultural system is a fundamental system which is involved to stress. When we interact with society, look at this, when we interact with society, first affect our mind. First involve our psychological system. Next involve nervous system. Then other organs. Next is that the chemistry of our human body will be changed, whether balance or imbalance, or normal or abnormal, which is determined by socio-cultural system. That's why we had emphasized that social medicine is fundamental for sustainable health and well-being. Then biosocial resonance. Situation of information incompatibilities will lead to change in central nervous system. Look at this word, biosocial resonance. Bio means biological factors. Socio means social factors. When we interact with society, biology will be affected. Change central nervous system, autonomic nervous system, and the neuroendocrine system. These systems are affect susceptibility to disease become greater. So this phenomenon is called biosocial resonance. Next, types of stress. Three broad stress situations or situation producing stress. First, short stress situations. For example, public appearance before large audience. First few seconds we may experience some stress. Second, moderate stress situations. Example, overwork. Severe stress situation, prolonged separation of loved one. So these are the three situations producing this stress. But fact is that the severe stress situation only cause the diseases. Detail going on. Look at this. Stress and performance. Can you see that? In x-axis, stress severity, duration. Y-axis, performance. Low stress, no performance. So this is a bell curve. Now look like bell. This express that relation between stress and performance. When increasing the stress, boredom and depression may experience. Then increased attention and interest. Look at this. This area is that interest. We have some interest to do something, but we should be experiencing some kind of stress. Not severe, but moderate. Look at this. Then optimum performance. The optimum performance, the person experiencing the optimum, which means medium level of stress. Then strong, increasing the stress, which cause strong anxiety. Then reducing the performance. Next, severe stress, completely meltdown. A person unable to do nothing due to overstress, which cause to the diseases, ended with mental and physical illness. So this is a relation between stress and performance. Students, the many of them having lot of question. If stressless life is possible, is impossible. You know, every work we have some experience, some stress. So fact is that we are students, should be think about when we write the assignments or do some work in the study and reading or writing, we may experience some kind of stress. So that is improving our health status. Okay? So don't think about that stress may cause to illness or like this. Clear about it? As well as after they complete this course, when we join in the hospitals as a staff nurse, do some work, maybe increasing the overload. That time we need to manage to do it, to increasing our mental skill as well as physical skill. Then look at this. Low stress, no performance, sleep, inactive, bored and lame. Optimum stress, high performance, healthy tension, with tension having to finish our work, motivated and focused due to interest of our doing. Then stress overload, performance down, fatigue and exhaustion. Then high stress, low performance, panic, anxiety, anger, burnout. This is a area of stress cause communicable as well as opportunity, communicable as well as non-communicable diseases. Then types of reaction to stress. So this is very important knowledge for mental health nursing. We will learn next year. First reaction is that normal. Normally every person should be defense. This stress that we had been learned in first year, defense mechanism. Are you remember? Agalya, yes. Agalya.
Yes, sir.
Can you name few defense mechanism? Okay, Jefflin, can you name few? Jefflin Saija.
Yes, sir.
Defense mechanism.
Projection,
Yes.
formation.
Yes. Excellent answer. Thank you.
And
So
Thank
that
you,
is
sir.
last year we had been learned in psychology. So every person normally defends their stresses. There is a normal by means of various types of mechanisms. Second, neurotic defense is ineffective. A person difficult to defend this stress in social situations. Third one, psychophysiological defense fails, result in changed body tissue. Which means that situation, in social situation, a person unable to do nothing, unable to think, first affect the social situation, unable to solve the problem in the society, which directly affect the mental health and also physical health. So what will you do? Should be defense, stress, overcome it. Next phenomenon due to interaction of body and mind is that suicide. Why a person attempted or committed suicide? Emile Durkheim was conducting a study. In 1897, 4 types of suicide. First, egoistic suicide is due to not well interacted to large social structure. A person lack of interaction in the society. Example, military officer who is suddenly retired. Do you know that military camp? This every minute have been listed and work are there. A person, military officers can do interact with every person from morning to every minute. But after the retirement, what will happen? There is no person to interact. Clear about it? So that type of situations, the person experiencing stress and try to commit suicide. The experience are available in this, mainly in America, war situations, as well as in other situations. In mental health nursing, which may be called as one of the mental illness called post-traumatic stress disorder. Second one, altruistic suicide. Social integration is too strong. Example, military man Sam Royce by cutting stomach. Sam Royce means is a old example that Japanese soldiers who was unable to protect their own country, they suicide themselves. In modern society, which is example for love failures. For example, two boy and girl love with each other. They have been interact between them, everyday phone and exchange of materials. And suddenly one day, the boy may be cut off their love. A girl may be cut off their love. What will happen? They feel failures, fail to interact due to over and purposeless interaction with others. Third one, anomic suicide. Regulatory system collapse. Individuals are cut off from the group ties. For example, in modern society, we are living in a society, a person go to a particular group, participate with particular group. One day group may be dismissed from that group participation. What will happen? The person feel sad due to unable to interact with, due to cut off from that social environment, and try to commit suicide. Anomic. Then fatalistic, unalterable suicide, which is due to over regulations. A person unable to live in this society. For example, student suicide in hostel due to over regulation, irrational regulations. As well as we know that after the 10th result and 12th result, many students was suicide. The newspapers we can see, as well as TV news has shown that. Reason is that over regulation. If not win the exam, the parents may be conditioned, not win the exam, I will do like this. What do these students or child unable to living in this society? And ended with suicide due to over regulation in the family. Then look at this. Next one poster available to clear understand about suicide. Here that regulation, not enough regulation, anomic suicide. Fatalistic suicide, too much regulation. Here integration, interaction. Altruistic suicide, too much of interaction, which means purposeless interaction. Or irrational interaction maybe. Then egoistic suicide due to lack of interaction. Not enough interact. So this picture showing that some more clear. Weak ties, egoistic; strong tie, altruistic; many rule, fatalistic; no rule, anomic. Then suicide fact and figures. So fact is that the main cause of suicide is that social interaction. The World Health Organization says that it is the biggest healthcare issue in the society, in the world. Look at this poster, WHO. Suicide is the second largest cause of death. Age group 15 to 29. Over 800,000 people die by suicide every year. One death every 40 seconds. Then 75% of suicide mainly lower and middle income countries, mainly India, Brazil, mainly African countries. They mainly using that, that pesticides, hanging, etc. Then how to prevent the suicide? Talk about suicide, these mainly symptoms of suicide first. First symptom, talk about suicide. Always talk about I am going to die like this. Then getting the means of take your own life, which means they purchasing maybe gun. Third, withdrawal. They do not interact with other people. For a person normally interact normally, and suddenly maybe withdraw from that interaction. There is a symptom of suicide. Then mood swing, emotionally high, deeply discouraged the next. Fifth one, preoccupied with death, which means the person always think about death. Then feeling hopeless, which is a main symptom. There is no purpose. The person don't know about the purpose of life. Next, increase alcohol use, drugs use, changing normal routine, for example, mainly sleep patterns. Then doing risky, self-destruction and thinking. Then giving away belongings, which means a person away from a loved one or nearby. 11th one, say goodbye. 12th one, personality change, anxiety. So these are all these warning symptoms of suicide. Measures to prevent suicide. According to World Health Organization, restricting access to means. Reasonable media report, media should be concerned to educate the public. Increase the alcohol policies. Introducing the alcohol policy, mainly reducing the intake of alcohol. Students, mainly the alcohol as well as drug addicts, is a high risk for suicides. Then school-based intervention, which is very, very important. Teach about every students, educate about regarding suicide, how to prevent it. Then early identification and treatment. Then training for health workers. Mainly nurses doing fundamental role in the clinical setting as well as community setting. Educate the people. How to educate. Then follow-up care and community support. So these are the measures recommended by World Health Organization to prevent suicide. The fact is that the suicide is made due to main cause of social interactions. So we need to think about it, educate to our client as well as the families and patients, etc. So what do you feel about this? Next, importance of individualization and socialization in nursing. First importance, caregiving. Already we have discussed that The study of individualization and socialization essential for client-oriented care. Then treatment. Students, this is a social medicine we should be prescribed to patients. For example, if a person come with blood pressure, doctors may be written only this pharmacological medicine, which is control the blood pressure, never cure. It's a chronic disease. The only cure is that social medicine, like individualization, do their own work, socialization, interact with others, reduce the stress, so which is the effective medicine, sustainable social medicine. Then prevention, prevent the communicable and non-communicable diseases. Then promote holistic health, physical, mental and social well-being. Next, nursing management, mainly this nursing student management, nursing professional management. Next, disease management in clinical aspect. Manage the communicable diseases as well as non-communicable diseases. Then health education. The nurse as a health educator should be educate the client regarding individualization and socialization phenomena. They don't know about it, So these are the reality of the health promoting factors in the society. Then counseling, client-oriented counseling. We have to guide the patients and families, improve their individualization and increasing socialization, and promote adequacy. Eighth one, nursing research. So these two important phenomena is very important for nursing research in every aspect of nursing research. Mainly research tool formulation for mental health nursing as well as medical surgical nursing, etc. Then all nursing disciplines use this knowledge to maternal health, and every mother should be individualized for happier motherhood and socialized. Then child health nursing to prevent the disease, promote health, medical surgical nursing for pain management as well as cure the diseases. Socialization is a medicine, can cure blood pressure as well as other physical illness, diabetes. Then mental health nursing. This socialization and individualization is fundamental for various psychotherapies. Then community health nursing. We should be create awareness regarding individualization. Every individual should be their own work and be active away from the diseases and educate about what are the importance of socialization. Let's talk to away from stress to community and families. So these are the importance. Then conclusion will be later, next class. So what we had learned today, key points are how we have been experiencing how diseases, the society, how to cause disease, the communicable and non-communicable diseases determined by social situations, how to overcome it, should be socialized and individualized, solve their own problems, don't depend on others. Any situation, do not stress or anxious. Use defense mechanism. Defense your stress and tackle, overcome, and be happy. As we know that the next key point is that the physiological changes when negative situation in this society, this human body difficult tackle, the chemistry of body will be changed and cause communicable as well as non-communicable diseases, mainly cardiovascular and neuroendocrinal disorders. Then social system, social cultural system is a fundamental to determine. Next key point, suicide. Next key point is that stress and performance. Many of them feel that stress, overworking may cause the stress. So overwork is increasing your skill and ability, not reducing your performance. So stress only caused by a person unable to do which situation. So stress may induce to unable to do work and may produce anxiety. That situation only a person experiencing disease and disabilities. So we are students should be aware about it, do work and actively do all the activities in the student life which help to in better job performance in professional nursing. So this knowledge is very important for us geared to our patients and families and promote healthy communities. Then suicide. The cause of suicide mainly the social interaction, over interaction, over regulations. So what we will do, we should be geared to others to reasonable interaction, and reasonable regulation is essential to prevent suicide. So the individualization and socialization is very, very important. Social medicine can cure every types of diseases, can prevent and promote holistic health. Okay. Question. Aradi M. Aradi. Blessy A. Blessy. Okay. Jeffrey Shaija. Can you name types of suicide?
Yes, sir.
Yes. Types.
I mean, first, right?
Yes.
So, right.
Okay, excellent answer. Good. It's enough. Thank you, Jefflin. Do you have any question regarding it today's discussion? Any? Okay. Anybody having any questions regarding today's discussion?
Sir.
Yes, bless you. Do you have any questions? Bless you.
No, sir.
Okay, thank you. Okay, students, thank you everyone. Have a wonderful day. Enjoy the day. Okay, thank you all.
Thank you, sir.
Okay,
Yes.
Jefflin. Yes,
Thank
Aswini.
you, sir.
Yes, Blessy.
Thank you.
Okay,
Thank you, sir.
Elena. Daya.
Thank you, sir.
Subida.
Thank
Okay.
you, sir.
Yes, Sonu.